My name is Edward McGillicuddy. I am a vascular surgeon here at Central Maine Heart and Vascular. We deal with a variety of blood vessel issues. It can be anything from veins of the legs, arteries of the legs, aneurysms that may involve the abdominal aorta, which is the biggest blood vessel in the body. We work on the carotid arteries in the neck. So really all sorts of artery and venous pathology or problems that deal with the artery and veins are our specialty. So we're all over the body. I always think, treat them as if they were a family member. And I think, as far as coming up with a big motto or a long description of what you do, I think if you treat patients how you would want your mother, father, sister, brother, girlfriend, boyfriend, whatever treated, I think that's a good guiding principle, and I think that will lead you to some good results. I love vascular surgery because there's lots of different ways to deal with problems. I think vascular surgeons are uniquely equipped to see problems through a variety of lenses. We do some procedures through the groin using catheters and wires, minimally invasive techniques like a cardiologist would do stents in the heart. We do some that involve incisions. We get to work all over the body. And I think the best thing is that our patient population, we get to do longitudinal follow-up with our folks. So you may operate on them 1 year and see them for several years after that. And I think that long-term patient follow-up is really what makes vascular surgery great. If you look at our group, we have vascular surgeons, cardiac surgeons, cardiologists, all kind of working together. We have the resources to take care of patients that have a pretty complex vascular surgery and cardiovascular problems. However, we've got a small enough team that we're kind of limber, where we know each other, we know where to get help in a spot where we're in trouble. I just think it's that kind of, it feels big enough where we can do major complex procedures on people that really need it, but it feels small enough where you're not getting shopped around to a bunch of different doctors or different people on different dates. You still have that family kind of team approach, and I think that's where we kind of differentiate ourselves from other docs in other places and other teams in other places.